Excision of a limbal dermoid the size of a lemon in a rare case of bilateral golden hair syndrome. This 12-year-old girl had presented to our OPD like this. She had bilateral limbal dermoids with anoxia and microtia. We planned a dermoid excision for her. We took two lid fraction sutures through the superior eyelid to help in the exposure, and we started a meticulous dissection of the limbal dermoid from its limbal and its corneal attachment. Once the limbal and the corneal area was free, we started with the scleral dissection. The initial part of the limbal dermoid was adhered quite strongly to the sclera, and this had to be dissected very carefully, trying not to injure or damage any as little scleral tissue as possible. Luckily for us, once those strong adhesions were dissected, the rest of the limbal dermoid was just abutting on the scleral surface and had very superficial and flimsy attachments to the scleral surface. Because it was such a large dermoid, we were very careful during its excision, ensuring that we are not injuring any of the extraocular muscles. So this here is the lateral rectus muscle. A blunt dissection was carried out to separate the dermoid from its attachment to the various tenum tissue and scleral tissue. Here we are isolating the inferior oblique and meticulously separating the fibers of the inferior oblique from the dermoid. After we have separated the dermoid from the extraocular muscles, here we are dissecting the limbal dermoid from the palpebral conjunctiva, trying to preserve as much of the conjunctival tissue as we can to aid in the surface reconstruction later. We can see how the palpebral conjunctiva has keratinized over time because of the presence of such a large overhanging dermoid. This is just the last bit of the dermoid excision. This is the stalk of the limbal dermoid, and we are excising the stalk and completely freeing the limbal dermoid from all its attachments. Once the limbal dermoid is excised, we are checking the integrity of the extraocular muscles. This is the lateral rectus muscle, and that there is the inferior oblique muscle. Now we will be suturing a lyophilized dry AMT 360 degrees along the conjunctival margins. And in the end, we will be taking two fornix forming sutures to help in forming the inferior fornix better. This is how the child looked post-operatively after 6 months of excision. Excision of a limbal dermoid the size of a lemon in a rare case of bilateral golden hair syndrome.
Taking the VMT. You are not using any glue?
No, sir. Sir, actually we are in a government setup and this patient was very poor. So she was not able to afford any fibrin glue. So that is why we did not use fibrin glues. Otherwise, had fibrin glue been there, it would have been much more convenient and comfortable for the child.